We are here with Lauran. How are you doing?
I'm doing great.
Good.
Nervous, but doing okay.
Nervous? Okay, so Lauran is being very sweet to let you guys watch. She's also being very sweet. We have a film crew in from Paris. There's a meeting in CAST coming up next spring, and we're recording Lauran's surgery so that we can do some teaching there next spring, and she doesn't have to travel all the way to Paris. What are we doing for you today? Maybe after. We'll go later. What are we doing for you today?
We're doing a deep plane neck, facelift, browlift, fat transfer to cheeks and temple, and earlobe reduction.
That's what I have on the menu.
Okay.
So, Lauran's got pretty good looseness in the lower face neck.
Mm-hmm.
And this looks like skin, and it's partially skin, but this section right here, this little piece, can you tighten up your neck muscles? You can see that's muscle under there. Can you see that? Relax again, tighten up again. You'll see that's a cord of muscle. And so the platysma muscle, the front edges are here, and then the back edge trails out right here. That's carrying the skin. So when I treat that platysma muscle and retighten it, that's going to control most of the skin looseness in the lower neck. It's not about skin in the neck and pulling the skin back. So she's one where I'm going to get a much nicer result with the techniques we're currently using than even what we were doing 6 months ago. So I'm really excited for you on that. Face me. She's also got a pretty good amount of looseness in the lower face, real far forward, far away from the ear. And this is where a deep plane lift completely outshines a regular smash facelift or a plication lift or a skin lift, because the deep plane lift has power all the way out front here, whereas a regular facelift, smash lift, smash plication lift, the farther away you get from the ear, the less effect you have. Tip your chin down just a little bit, and you can see most of her need, and actually the secret is most of everybody's need is farther forward in the face. So that's one of the reasons why that deep plane lift is going to be so much more beneficial. Turn this way again. What are you feeling? What are you thinking? You agreed to be on this little video because?
Oh, because I want to help other people.
Yeah.
I watched your videos with others, and it was very convincing for me and gave me the courage and the comfort level to move forward, and I'm feeling really good about it.
Good. Well, I'm not going to torture you too much more. We will do little updates, hopefully every few days in these first 10 days or so. Are you local or do you live elsewhere?
I'm from Memphis.
Memphis. Okay, so 4 or 5 hours, not too bad.
Mm-hmm.
So we're going to ask her to spend at least the first few days with us. And if someone that's here it's a long drive, we tell them 10 days.
I'm here for 10 days.
Perfect. Okay, good. Well, thank you, and we'll do our absolute best for you.
Thank you. Let's do it.
My name is Karen Tharp. I have the pleasure of being Dr. Nyak's nurse practitioner and on his OR team. And I am here today with Lauran. She is post-op day 1. And how are you feeling today, one day after surgery?
I feel okay. A little woozy. Had a dull headache through the night, but nothing bad and no pain anywhere else.
Okay. You bring up a good point. So a lot of times we do see a little bit of a headache, especially with a brow lift. Pretty temporary. It does seem to resolve. We do typically have a brow drain still in. Now the nice thing is that was the only drain you had in, correct? So you did not have the neck drains. That's something that Dr. Nyak has been able to not have to place. We haven't been putting in neck drains most of the time recently, so.
I know he's very excited about that.
Yes, absolutely. So how overall was your first night? Were you able to sleep?
Yes, I did. I slept for a good 4 hours straight. The hardest thing for me, it's not the pain here, is getting used to sleeping flat on my back.
Yes.
And that's the thing, but it's just as all fun.
Yeah.
Other than the slight headache.
Another good point that you bring up. So we do ask that you lay flat at night, and that's just for the swelling to kind of start to drift back towards the lymph nodes. That's pretty important. We also like to keep your head and neck at a neutral position so that you're not stretching your neck forward or with a pillow behind your neck or head. We don't want your chin to be to your chest, so kind of a neutral position. That's really important.
Got it.
Very good. Anything else you'd like to share?
I've only done it, other than it's been a lot less uneventful than I thought it was going to be.
Oh, well.
And everybody here's been great, and have complete confidence in everybody. I'm
That-
very glad I did it.
That's wonderful. Well, thank you very much for sharing. We appreciate that.
Mhm.
Hello, everyone. Karen with Dr. Nyack. I'm here with Lauran today, and she's post-op day 2 after her surgery. And you look really, really good.
Well, thank you.
Yes.
Thank you.
How are you feeling?
I felt pretty good.
Okay. Had a little headache yesterday
And
from
it-
the brow lift,
And it's gone.
and it's already resolved. Good.
Yes, and a little dryness in the mouth. But as far as my face, and it's been not hard at all.
Okay. So you've
Very
been
surprising.
wonderful, wonderful. So you've been up kind of walking around leisurely.
I have.
Okay, good. And it's a nice day out today, so you plan to go walking a little
I
bit in
do.
the park, so up and around a little bit. Good. Okay, and Dr. Nyack did something for you today. What did he do for
You
you?
gave me a peel.
A VIPL, yeah. So we went ahead and
feel
gave her
special today.
absolutely a little VIP treatment, didn't we? So just for some hyperpigmentation, we wanted to do a little bit of a peel for her. So that was something that Dr. Nyack offered for her, and
And I really appreciate it.
you
So
look
thank
really good. Very good. Well, I'm glad you're feeling well. Anything else that you want to tell everyone?
I don't know. It's just been surprisingly a lot less pain than I thought, and I was nervous coming in, but I'm so glad I did it, and I'm on the mend. So,
Very good, and you really do look good.
well, thank you.
You're quite welcome. Thank you.
We are day 6 with Lauran. How you feeling?
Feel pretty good.
Good. So one of the things that you'll see on Lauran's face that you don't see on most face neck lifts right now, she's starting to flake. I don't know if you guys remember when I did a VI peel on myself maybe a month ago, something like that. Well, we did a VI peel on Lauran the day after her surgery, just to get a little bit of brown spots treated, but still not hinder the ability to go out and enjoy the sun, all that kind of stuff. So how are you feeling on the skin layer now?
Yeah, everything's, the numbness and everything's starting to feel like me, but the skin layer, I can feel it coming off, flaking off, and yeah, I'm okay.
Yeah, you can just kind of see like almost a little rise to the surface, and it looks almost like a Elmer's glue layer that has dried, and you can kind of see the texture. You kind of you feel like you want to peel that glue off, but we don't want you to peel it.
Okay.
It'll come off on its own over the next 2 or 3 days.
Okay.
And it's one of the things, if we're not going to do full CO2, which honestly in my patients that have had CO2 together with surgery, they'll tell me the CO2 is the worst part of the recovery, believe it or not. This is kind of a nice brightens up pigment and kind of freshens up the surface layer of the skin. What have you been doing diet-wise? What have you been eating, not eating?
I've been eating better than normal. I've been eating fruit and low sodium soups. I actually have had a turkey sandwich, what I was able to eat.
Good.
Small bites, not, and rice bowls. And yeah.
Good. And then the last question I'll ask, this is all the logistic stuff that people, because Lauran came in from out of town. Where are you staying? Not exactly, don't tell them exactly where.
I'm staying at the Residence Inn.
Okay. And what do you like about the Residence
I
Inn
love the
situation?
room. I love the room. It's big enough. It has, because I had an overnight nurse. Thank you.
You're welcome.
And she had her own space. I had my own space. It's super clean. They're very accommodating as far as parking passes for the nurses in and out. It's great.
Yeah. Well, turn towards me because people are going to want to see your profile. This is normal. These are the little tiny stitches. We'll take those out tomorrow. Those are on day 7. There are a couple of little tiny stitches that are her chin. Those will come out. And then I have clips in the hair, staples in the hair. Feel free to turn back. Staples are nicer. When the incision is inside the hair, we get less temporary hair loss with staples than we do with sutures. So they look kind of gross, but they're nicer for you. So that's the plan. All right, well, thank you for letting everybody follow along with you. I really appreciate it.
Thank you.
You're welcome. I hope you found this information helpful. If you did, hit that subscribe button and turn on the notification bell icon so you can see my future content.